Hi, everyone. My name is Christina Rendon with KTVU Fox 2 News in the San Francisco Bay Area. Today, we are joined by Lenore Anderson, President of Californians for Safety and Justice. Lenore, thanks for being with us today.
Thanks for having me.
Let's start off with the work that you're doing today. What is the focus of your organization's work?
Well, Californians for Safety and Justice was founded to advocate for a new approach to public safety. We advocate for reducing incarceration and increasing investments into communities, investments into things like rehabilitation, crime prevention, and support for crime victims.
Okay, and so because of this pandemic that we're in, I'm assuming the focus has now intensified.
That's right. The COVID pandemic has certainly brought into sharp focus the challenges in our criminal justice system, especially as it relates to how the criminal justice system can worsen public health for people who work in it, people who are incarcerated in it, people who are coming out of it.
Can you talk a little bit about how dangerous it can be? I know that we've had issues with nursing homes. There's been outbreaks galore in nursing homes. There was an outbreak, I think, also in a prison down in Southern California area in Lompoc, because people are in close quarters, in institutionalized settings. Talk to us about how dangerous that can be for this pandemic.
Yes, it is absolutely concerning. For people who aren't as familiar, prisons and jails were built literally by design to keep people in very close quarters. It's impossible to social distance inside a prison cell or inside a county jail. That is a risk to public health for both people who are incarcerated as well as people who work in the facilities. So part of the reason it's so important to reduce unnecessary incarceration is so that we can protect the health of both the people who live there and the people who work there.
Right. And I know around the Bay Area here, at least, we've heard of inmates being released from our local jails. I mean, what are your thoughts on that? Is it enough? Not enough?
Well, California has increased incarceration over the course of many decades. It is still, incarceration has come down a little bit in the last 5 to 10 years, but we incarcerate people in this state at about twice the rate we used to back in the 80s and 90s before the state started building prisons. California has built 22 prisons over the course of a 25-year period. That far outpaces the number of education facilities, for example, that we've built, higher education. So it's really a state that has, over the long term, greatly increased the number of people going in. What we know from a public safety perspective is that that's unnecessary. We incarcerate too many people for too long. If we're trying to ensure that we can stop the cycle of crime, we can do that effectively by holding people accountable through community supervision or victim restitution or other things. Or for those who are incarcerated, we can have those sentences much shorter and still achieve public safety. So from our perspective, we still got a ways to go to get those incarceration numbers down.
Are there specific prisons you're focused on right now that you're pushing to get inmates released from?
We are focused at across the state. We work on advocating for reduced incarceration and increased community investments all throughout the state. The state prison system has facilities up and down all parts of the state. We do a little less work at the county level. We're a statewide organization.
Okay. And then talk to us also about the fact that right now with this pandemic, the virus really, we've seen and heard stories that it's impacting communities of color at a disproportionate rate. They're more at risk. We're more at risk. So how do you approach that, or what can be done about that?
Yeah, the disproportionate rate of impact of COVID in communities of color is absolutely a humanitarian crisis, and one that this country should take very seriously. In our work in criminal justice, one of the things that we have seen for generations is that mass incarceration has worsened public health outcomes. It has worsened the health outcomes of people who are in contact with the justice system. it's also a system in which we've seen sharp racial disparities in terms of who is incarcerated, how long people are incarcerated for. And so you can look at this and say that part of the reason that we have racial disparities in who's being impacted by this health crisis right now is because of racial disparities that exist in our justice system and because of disproportionate expenditures. Had we spent less money on prisons, we could have put more money into community health. We could have put more money into the kinds of things that vulnerable communities need to be stable.
What do you say to people? Because I know there's people out there that if they watch this, they're going to think, why are we letting people out of prison? They're there because they committed serious crimes. What do you say to those people?
Well, one thing that a lot of people don't know who aren't involved in criminal justice is just how many people are incarcerated unnecessarily. A lot of the people who are in our prisons, in our jails, are not a risk to public safety. They could be safely released, or they could complete their sentence in a community supervision setting. We have sentences that are too long, and we put too many people inside facilities when we could hold them accountable in a different way. So that's one important piece of information for the public, is just how low of a risk a lot of people are who are incarcerated to public safety. The second thing that's really important for the public to understand is there is a way that we could make decisions about who's incarcerated and who's not based on their risk to public safety, but that's not always how the decision is made. We have these old sort of bureaucratic systems where it's just, we always give someone that sentence of 8 years because that's what we do. And it's not necessarily based on science, based on data, based on what we know about how to stop cycles of crime. So this crisis has illuminated that, and it's provided us an opportunity to really rethink that. If ever it were important, it's now to stop incarcerating people unnecessarily, because it's a risk to everyone's public health.
Sure. And I don't know if you have numbers available just in terms of when we talk about racial disparities. Do you know how big of a gap that is? Or we just know that because communities of color have long been at a disadvantage, now, of course, it continues to be in this pandemic?
Well, I know as it relates to disparities in the justice system, or as it relates to the pandemic.
Well, I guess both, if you have both.
Yeah, I mean, not every state is reporting on race ethnicity as it relates to who is contracting the virus. For the states that are reporting on race ethnicity as it relates to the virus, we've seen a lot of disparities. I know in Chicago, for example, 70% of the people who've contracted the virus are African American, despite being 30% of the population. In states like Louisiana and Alabama, we're seeing a similar disproportionate rate between total population versus who's contracting it. And then independent of the pandemic, when you look just at the justice system, in California, this is a state that has historically incarcerated African Americans at about 5 times the rate of white Californians, and Latinos have been incarcerated about twice the rate of white Californians. And so we've seen that disproportionality exist in the justice system. We see, independent of a pandemic, we see health disparities that have existed for a long time. And now we're seeing those health disparities in terms of who's impacted by COVID.
Yeah. What do you think, if people are watching this, what can be done? How can we help? Because I know even just today, like, for example, the mayor of Oakland announced this emergency task force because she said that COVID-19 is affecting communities of color disproportionately, and she wants to create this task force on a way to respond to that disparity. What can people do? Can they do anything? Can they help?
There's always ways that people can take action to support positive change. If ever there were a time to replace our approach to public safety from one that's purely punitive, that's focused on responding to crime and incarceration, to one that's about crime prevention and community health, it's now. People can get involved by talking to their local elected officials, their state, even their federal elected officials, and calling for expanded resources for community public health. Things like violence prevention, trauma recovery for survivors of violence and crime, reentry for people who are coming out of prison and jail. Those community health services have been operating for far too long with not enough resources and not enough support. We need to lift those up, make those the centerpiece of our public safety strategy, because it's also at this point about public health.
What do you think is going to be the future of, I guess, state prisons? Do you think that this pandemic is going to possibly change how many people are incarcerated?
It certainly should. It certainly should. I think that the fact that this crisis has taken the flashlight and focused it on what's happening inside our prisons and jails, I think that's very important. I don't know that enough people understood the public health problems that exist inside our prisons and jails and how unnecessary that is in terms of protecting public safety. And so I think this crisis can lead to an opportunity for a real transformation. If we could overhaul our approach to public safety and make it about supporting community health first, I think that would be a tremendous positive outcome.
Before we kind of wrap up, I kind of want to ask you about what reentry would look like. So you're saying not enough resources are given to things like that. What would be the ideal reentry process for inmates?
Well, there's two things that need to happen in the world of reentry, and by that I mean to stabilize people who are coming out of the justice system. First, a lot of people may not know this, but after you've served your sentence, after you've completed your time, people with prior records, prior convictions, face enormous barriers to eligibility for things like jobs, housing, loans, you name it. We have actual legal prohibitions on whether or not people with convictions can be eligible, for example, for different types of occupational licenses. Can you be a barber? Can you get a license to walk dogs? All of those types of things. We've got to get rid of those nonsensical barriers. These are legal prohibitions to people's stability that make no sense from a public safety perspective. We got to set people up for success. We got to set people up for being able to have meaningful rehabilitation. So number one, we got to get rid of these barriers that people face to jobs and housing that have convictions. The second is there's a network of small nonprofit organizations that help people coming out of prison and jail find housing, find jobs, find stability, get access to health care. Most of those organizations are working because they believe in the work, not because they have a ton of resources to do it. And we really need to give a lot more resources to these organizations. Some, operate from the back of a church. Some are operating out of people's homes. This is a network of people who are trying to help you land on your feet when you come out of the justice system. And there's just not enough support. So California, as well as the federal government, can start to make reentry a real substantial part of what we fund when it comes to public safety. And I think that'd make a huge difference.
Okay. How long has your organization been in operation? And specifically for this year, how has your success been in trying to advocate for the release of inmates?
So Californians for Safety and Justice, we began in 2012. And so I guess that's 8 years now, which is kind of amazing. Time has flown by. We have been successful at changing a lot of criminal justice policy in the state. Just a couple of things that we've been up to. So we were co-authors and supporters of the Proposition 47 campaign and the Proposition 57 campaign, which were voter-enacted ballot initiatives to reduce incarceration. We also have been advocating for the development of trauma recovery centers, which are for victims of crime, which really focus on full circle, wraparound support for victims of crime, people who've experienced traumatic violence, helping them get stable and back on their feet after experiencing terrible victimization. It used to be California only had one trauma recovery center. There's now 12. And all of that is coming through state funding that we've been advocating for along with our partner organizations. So those are the kinds of things that we spend our time on to try and help improve public safety in California.
Okay, sounds good. Is there anything else I'm leaving out that you wanted to add that I didn't quite ask?
I appreciate the conversation and really appreciate your interest in all of this.
All right, Lenore Anderson, President of Californians for Safety and Justice. Thanks for joining us today.
Thank you for having me.